What we put in, what our body has to digest, plays an important part in our overall health. And that overall health, when dealing with perimenopause or menopause, basically kind of dictates what you may or may not experience also.
When you see, talk about the brain, talk about the gut, they have a connection. You talk about mental health, same thing, gut connection. You see, nobody addresses those two there because, again, it's a hormonal and a chemical imbalance.
Midlife transition. I know we all think it's a midlife crisis, but it really is a midlife transition, and it's the experience of menopause. It's so much fun. And tonight's guest is Dr. Lori Dalcour. Tell us a little bit about yourself before we get started, and really what the purpose of tonight will be about.
I started back in high school, Croston Senior High School in Temple Hills, Maryland. That's where I got my start as a nurse. I graduated from 12th grade as a certified nursing assistant. And then I continued on and received my associate's degree and passed the boards as a registered nurse. I went on to get my bachelor's degree and my master's degree as a women's health nurse practitioner. And I recently graduated this past May from Georgia College and State University with my doctorate degree. So as a DNP, so that was very exciting. We actually had 3 graduations in our household. I graduated with my 17-year-old twins. They graduated from high school. So that's it as far as my education, I believe. But as far as my being in the workplace, again, a nurse for 30 plus years and a provider for 20 plus years. So I still practice at the Healthy Woman, as you mentioned, and I'm also faculty at Georgia State University. So I teach the women's health course. So nursing is me. I did a short stint in other jobs, but overall, I have walked in my gift, which is nursing, and it is women's health. So I've done everything from areas dealing with working in the hospital and the postpartum, labor delivery, high risk antenatal care, to once again also working in private practice clinics, but all things women's health. So I'm excited.
That's awesome. And I'm so glad you're here because I wish I'd known there was women's health practitioners out there when I was, I'm going to say in my early 40s, maybe even late 30s, right? Is when you start to go through the change, but you don't understand it as that because really nobody talks about it. You know, your mom, your sisters, I have all older sisters, they all go through it and they all go through it differently, I think. So it's really not something that's talked about.
It really isn't. And so that's what my whole motivation, a lot of what you're mentioning is what I discuss here. You see this picture here. This is my sisters. And you see this image, and I apologize, it's kind of blurry, but it looks a little chaotic. But I'm going to be totally transparent here. My passion, I'm all things women's health, but I went through an experience in my life where I did not know what was going on. I was just in this place where I was having anxiety, feeling depression. I developed high blood pressure. I was a late mom here. I had my twins at age 40. And after delivery, everything went well with my pregnancy, but after delivery, I wound up developing high blood pressure, which I continued to take medication for that. But at the time when I was feeling these symptoms of sadness, depression, and anxiety, my blood pressure was acting very crazy. I mean, it was literally going to 200 over 100 something. at times. And it did this on several occasions, to the point where as one night it went up, and I wound up calling my sister. She's on the end in the black sweater, but I wound up calling her. She was downtown in Atlanta having dinner with some friends. And this was not the first time I called her up when I was feeling these symptoms. My husband was even having to kind of deal with what was going on. And on this one night, he was on his way back home. He was a couple hours away. I called my neighbor over to the house, and my sister showed up. And I'm just walking around. I'm just praying and everything, because I'm just like, just felt like I was going crazy. I felt like I was going crazy. So my sister, she turned around, and both of my sisters are nurses. Once again, the one on the end, she's an adult health nurse practitioner. So her thing is always saying, what changed? What changed? She's like, something has changed. And she said to me, Lori, I bet it's your hormones. Now, again, I just mentioned to you all, I've been a nurse for 30 years, women's health provider, 20 plus years. And my sister's telling me that I'm going through hormonal changes. So first, yeah, not really receiving it. But again, maybe she has something here, because I'm going crazy. I don't know what's going on. I've never felt this before. I didn't know. So she
How old
started
were you?
talking. I'm sorry.
How old were you?
Well, at the time when I started experiencing the symptoms that I had, and to be honest with you, I think they came earlier on, because I want to say my symptoms may have started around early 40s, when I was having some anxiety. The hot flashes didn't come till later on, when I was probably around, I say age 49, 50, and going into that. So this is what I will share. I had a hysterectomy. So for fibroids, that's why I was kind of lost to what was going on with me. And I'm going to kind of leave it there and move to the next slide, because as I'm speaking to these things, I want to explain to you all, because when we talk about menopause, and I usually say it's like puberty in reverse. We start off during those reproductive years, the hormones kick in, and then as we get older, the hormones start to decline. So thinking of it in that direction, but menopause is pretty much a retrograde diagnosis. It's going 12 months without having a cycle. So a lot of times women are thinking that, or individuals are thinking that, we're able to diagnose menopause, but we're not. There's no test that we can do to say, oh, this is where you are. And again, I'm going to speak more into that. But what happens with it is you're coming into office, you're missing these cycles, they're becoming irregular, you're starting to skip them, and pretty much based on where you are, and we're really speaking tonight about women age 40 and beyond. Okay, so do any tests. There's no test that your doctor, your provider, your midwife, or your women's health nurse, no test that we can do that's going to say, aha, you're in menopause. So I just wanted to kind of be clear about that. So as you see over here on the next slide, statistics-wise, about 2 million women reach menopause each year in the US, and 52 is considered to be the average age of natural menopause. As you can see, women live about a third of their life in menopause. And sometimes we just need to take that in, because this is why we need to be having this discussion. And this is why are we not having this discussion? A lot of times when we are going through school, where the topic is touched upon, but now, as you notice, a lot of women are really asking the question, because we're experiencing all those symptoms you had seen, and just going through things that we're not even understanding. It was one point where, like in the 19th century, the uterus was considered to be insane. I mean, women were having hysterectomies just for the fact of the symptoms that were being experienced. and then as we move more towards the 20th century, hormones came into play, estrogen, progestrogens, and things got better for us. But of course, there was studies done by the Women's Health Initiative that kind of, it was done on older women, and just kind of not going into much detail, hormones lost favor. But now, we're trying to gain a greater understanding. Just like I'd like to tell women, just like with contraception, there's a better understanding of the use of hormones. And now we're in this place where, yes, in the 21st century, we're asking questions. We're trying to have a better quality of life, a greater well-being as we deal with the menopausal transition. Now, what is perimenopause? So we were talking about menopause now, but perimenopause is that time period that precedes menopause. And so it really goes, and again, we're talking about, again, starting at the age 40, because there are some patients who will experience symptoms of menopause or deal with symptoms of menopause. There could be someone who's going through chemotherapy, or maybe a patient who has premature ovarian insufficiency, and that's less than age 40. So we are talking about natural menopause pretty much just happening at the age 40, and once again beyond, but the average age being 52. So usually 40 until you go into menopause. And again, this depends on the individual, because you have some people who may go into menopause in their 40s, and you have there are a few women who may even go beyond age 52. Again, once the menstrual cycle has stopped for 12 months, you're stated to be in menopause. So up until that period, until you hit that 12th month, you are in perimenopause. And then after that, you're in menopause, and then you go into postmenopause. And this is the place where a lot of times you start experiencing those symptoms, and a lot of times this is where you're having those irregular cycles. Now we deal with, let me say this, in dealing with irregular cycles and all the symptoms that you pretty much have seen, that does entail a full workup, because there are a lot of medical conditions that can mimic being in menopause or perimenopause. And I just wanted to mention some of those symptoms that you may experience during that perimenopause period, like hot flashes, insomnia, you dealing with mood swings, night sweats, which are pretty much your hot flushes or hot flashes, whatever term you want to use, but happening at night. And you may deal with some weight gain coming from just aging and lifestyle. And menopause does come into play, but a lot of times we have to look at those things, and a decreased libido, decreased sex drive, and also genital urinary syndrome of menopause. And we will talk about that, but some other things, skin changes, hair changes. I mentioned to you about anxiety, depression, cognitive function, all of those, along with many other things, many other symptoms you can experience. So as I was mentioning, a lot can go on. They could point at menopause, but as a provider, we have to be very open to make sure that we're not missing anything, any other type of medical issue. So I actually had a conversation with a medical student when I went to see my primary doctor recently. And I told him, we were discussing menopause, and I was talking to him about everything. And I just asked him one thing. I said, when a woman comes to you and she's dealing with multiple things, I said, please keep menopause in the center. I said, because a lot of times you can have women coming in experiencing irregular bleeding, heavy bleeding. Look at their age, look at where they are, one as far as fertility, other health issues they may have going on. And a lot of those symptoms that I mentioned to you, they might even be dealing with a lot of stress. And so I was just pretty much saying, remember to kind of leave menopause in the center. So you may be experiencing one of these symptoms or multiple, but yes, you want to have that discussion with your provider. But at the same time, just know they're probably going to want to do their lab work and consider other medical issues that may be causing those same symptoms. And of course, if all things come back being normal, or even if some things are out of range, it's still part of our differential of saying, hey, is this person dealing with perimenopause, or are these symptoms that's kind of leading up and showing that they're headed in the direction of menopause? So that was just something that I pretty much wanted him to think about. Also, being mindful of the changes that go on. So we're dealing with the changes of all those symptoms that I just mentioned to you. Now, just think about the compounding the fact of the sandwich stage. And the sandwich stage is when you have women, such as myself, who are raising kids and also having aging parents. So a lot of times women are having to do a balance act, because here they're in the middle. They're dealing with these kids who are most likely in school and having to activities that they have to take them to, or help them with homework or something of that sort. And they also have aging parents. So again, that's a lot on women. And that's what kind of increases their stress. And there may be medical issues, such as myself. I had high blood pressure. You have other people who might have diabetes or some other type of medical issue, again, during this transitional period. Relationships. Okay, we talked about mood swings, anxiety, all those things. So once again, if you're having mood swings or you're irritable, be it in your marriage or with your children, at work, it's a chance that may impair friendships and cause strife in different places. So that's something that we're having to look at also. And then there might be other midlife issues, loss of job or switching jobs, dealing with financial circumstances, divorce. So you have to take into account all these things that women are experiencing and transition. Sometimes you may have to move, or you're continuing your education or promotion and having to work hard. So again, the midlife transition just entails so much, not just only the symptoms that you're experiencing at that time and what you're going through and the changes, but also dealing with different midlife issues. So that's one thing we have to be mindful of too, when we're talking about that additional stress that kind of builds to what we're experiencing. Okay, now one thing I always dislike is when somebody put a slide up and say, oh, this looks pretty busy, confusing, but don't worry about it. And I'm going to tell you all that tonight, but I just wanted to introduce you all to this because we're talking about women understanding. And so this is the staging system for the reproductive cycle overall. And this is what we were talking about earlier when we say about hormones, when we go into the doctor's office and we're like, check my hormones. And as I was saying, there's nothing that kind of can diagnose menopause. But one thing, the main thing I wanted to point out with this slide is because when women come in, they say, check my hormones, and I apologize, this is being sensitive, like FSH, the follicle stimulating hormone. And these are hormones as far as, the follicle stimulating hormones with the ovaries, but they're just different type of markers. And because I don't want to confuse you too much, but they're different type of markers that we can use. But a lot of times these markers are used when we're dealing with patients with infertility, and they're attempting to get pregnant, but at the same time, they may be helpful with women such as myself who had hysterectomies, and you're trying to gauge where they are as far as the hormone levels are going with their ovarian as far as reserve and everything. Again, if you're talking about somebody attempting to have pregnancy, their ovarian reserve, or again, if you're just trying to see, hey, are those ovaries kind of shutting down, or the hormone levels rising higher, like for the follicle stimulating hormone, a lot of times we'll look at if it's greater than 25 or higher, and we'll also look at the estrogen levels. So when you come in and say testing hormones, and so to answer the question earlier, why can't we diagnose? Because until the ovaries truly do, and just to be clear with it, until the ovaries really do stop functioning, then the hormones can really be variable there. They can fluctuate. So you could come in the office one day and it's one level, you come in next week is another level. So until you actually had those full 12 months, those ovaries are still kind of working. And so that's why, we really cannot just count on the hormone levels, because again, they can fluctuate. and you're trying to say, am I here? Well, the only way we know if you're there is if you go 12 months without having that menstrual cycle. And so down at the bottom, we were talking about some of the hot flashes and everything, which is known as the vasomotor symptoms. And you can also see some of the encircled and highlighted in blue, the symptoms of urogenital atrophy, which again, we're going to discuss that. But I kind of wanted to show, as far as, once again, we talk about the phase where you are in the menopausal transition, how you start having those vasomotor symptoms around that time that we were mentioning, and then getting more into what I like to call the genital urinary concerns. So again, I know this is not familiar to you, but just letting you know that there is a gold standard for staging and when it comes to the reproductive period. So again, this was just a kind of an introduction, but to not leave you confused, and now we're going to go to this image right here. Vasomotor symptoms, frequently termed hot flashes. They're really like the most common symptoms that women experience. And a lot of times this is in the face, you know, the neck and the chest area. And in this image right here, I wanted to show, because it just so happened, I went to lunch this weekend with two of my closest friends who are sisters. And while we're sitting there, they started having their hot flashes. And I was like, oh, let me take a picture, because they're both grabbing their bottles of water and using what they consider their cooling points. You know, one in her wrist and the other one had her bottle to her neck. And then also this past summer, we were celebrating my father's birthday, and my niece, she carried that fan the entire period. She was walking around the whole time during the party, and just being over different homes, because we have a bunch of family members around there. She carried around that fan. So, you know, hot flashes are that sudden intensity of heat, and they could be mild to moderate to severe. And I'm going to move to the next slide because I don't want to take too much time. This right here, a lot of times, again, hot flashes, vasomotor symptoms can affect like 60 to 80% of women. And I pretty much wanted to just show this picture, because one place that I'm hitting, because this is like aviation, and it made me think of that because we think about sleep disturbances and cognitive function and all of that, because one of the things that have piqued my interest that I'm looking forward to getting into greater at another point in time, but menopause in the workplace. Because a lot of times, you know, we talked about pregnancy fog, but what about menopausal fog? You know, we have to show up at work and function, but sometimes, you know, we're not able to function because we're dealing with menopausal fog. You know, things we're not even, the thoughts aren't coming that fast to us. Or, you know, even sometimes even the uniforms we have to wear. Imagine having one of them hot flashes and you're in a board meeting, or you're in this uniform where you have all these layers. And so these are things that we have to take into consideration. So they are starting to look at menopause in the workplace and legislation where it's concerned. And I think that is great, you know, for that reason right there. So let's see. Now, I wanted to share this because, once again, I wanted to kind of hit on those main things that I know that we talk about and we think about. So very quickly, this image right here is part of, you know, what we consider genital urinary syndrome and menopause. And one of the changes that take place is the thinning of the vaginal tissue. And on the well estrogen side, you can see how thick the tissue is over there. And then you see how when the estrogen kind of goes lower, we take on this hypoestrogenic state, you know, during menopause, you can see how thin it is. And this is where a lot of times women get that concern when they talk about the bothersome dryness, irritation, or just experiencing dyspareunia, which we consider, you know, pain with intercourse. So a lot of times, you know, when we talk about the genital urinary syndrome, that's what it is. It's, you know, women are having increased urinary tract infection or other urinary concerns. And in general, a lot of times they're experiencing different changes or symptoms involving the vulval area. So we talk about the labia, the vagina, the entrance into the vagina, So all those areas, they may have some different type of discharge or something going on. So again, just allowing you to be aware that of the term that is used, because it is a collection of signs and symptoms associated with estrogen deficiency.
So, Gabriela, I want to talk to you first. Are you experiencing any of these symptoms that Dr. Lori has suggested as part of this phase of life?
I started about 3 years ago, and it's horrible. Those hot flashes are horrible. I don't wish them upon anyone. But my hot flashes, I mean, I still have periods. I sleep well. So I'm not your typical premenopausal person, because I still do sleep really good. But I think it also has to do with the supplements I'm taking along with Age Pro. And I'm not looking forward to having hot flashes if they come back. And that's why I'm really consistent with my Age Pro, Belvie, Biogenistine, my Right Start. I'm basically also doing, when I remember, at least 3 times a week, I'm doing castor oil packs. I've heard also working on detoxing your liver can help as well, because our liver does help with our hormones. It's a multi-function organ. I mean, we have so many functions that our body works with our liver. So we have to take care of our liver and learn to detox. Maybe that's something we can do as a group as well, detox our liver. And I know we have plenty of experts here on the panel, and it's really important for that. So, I mean, I love our products. They are life-changing for me, and that's why I share them. I share them, and I love talking to people that when I have results, I love sharing what I experience.
My hot flashes have ended. I do get them a little slightly, but not since Age Pro. And I think the detox is just not, if I had any inkling of one, the detox has just gotten rid of that. So I think that your hormones are really connected to the phase of life we're going through, this menopausal phase. And I'm ready for the party, because that's how I'm feeling right now. That now I've been through this, like, it feels like 20 years, but it might not have been 20 years, but it sure feels like it. Dr. Romunda?
No, I have not had any flashes. No, I have not had. I'm sitting back listening like, wow, that is amazing. Knock on God's grace and mercy. I cannot be getting nude out in public, because I already see myself taking off my clothes when I start sweating.
Well, it's true. You do. You feel like I got to take everything off, and you put
I've seen
back
people
on, and then
literally.
you take
I've
everything
seen people
off.
literally
You do.
take off clothes. I mean, they take off clothes, and then they got the biggest fan, and they hitting it, and I'm like, wow, that's a gut issue. They be like, what? I'm like, that's a hormonal because of your gut. And they be like, wow. See, we're not connecting those two together. Just like the liver associated with what? Your gut. It's a part of a what? Detoxing a bile duct. So people not looking at how the hormones, the chemical imbalance, all of these things associate through what, Lori? Dr. Lori, what?
The gut.
The gut. All of these things.
Are you saying that this phase of life, this menopausal phase, can be controlled if we can get control of our gut? If our gut can settle down, the bloating, whatever goes on down in there.
Well,
if we can get our gut healthy, then our menopausal symptoms may subside.
Yeah, because it is. Because if you look at, like, understanding your adrenalines and your dopamine and all these secretions and all these adrenal, all these things have what? They hormones got connection to hormones. How you feel, your emotions, you're emotional. Just like Dr. Lori was saying, your anxiety. You know what I'm saying? So when you're looking at all these anxiety, if you look at a gut chart, you'll see the word anxiety, you'll see hormonal imbalance, you'll see, I mean, a whole list of things that falls under. So people don't put those two together. That's why they be saying, that's why I say you gotta be careful how you drinking your water. You gotta be careful how you digest them. You know, you gotta be careful what you eat, because if you're eating foods that's high in hormones, hormonal foods, then what do you think you're triggering but the hormones that you're dealing with? So the estrogen in our body, if we have a deficiency in that, we have a deficiency in these things, then you got to look at, what am I missing? Why am I deficient? And why am I having? And I'm like, then so when I hear, the most I think I can tell you I had little sweat between my breasts, and I just feel like they were growing. So that was the case. I didn't worry about it. But other than that, so I was like, well, maybe they just growing, they need, so other than that, I did not have none of the walking around with the fans. I have not experienced those things. And my menstrual stopped when I turned 50.
The part what Dr. Romunda's talking about, it just comes down to, a lot of times you want to start off with those lifestyle changes. And those lifestyle changes include dietary changes, eating healthy. And of course, what we put in makes a difference in how we feel. It makes a difference in how we're taking care of our bodies. So, there is that correlation with, because again, you're eating your fruits, you're eating your vegetables, you're turning around and eating your whole grains, hopefully, and of course, consuming your water, opposed to beverages that have a lot of sugar in them. So once again, dietary changes play an important factor. And of course, what we eat has to be digested, so that's where that correlation comes in, as Dr. Romunda speaking of, about having gut health. Because yes, what we put in, what our body has to digest, plays an important part in our overall health. And that overall health, when dealing with perimenopause or menopause, basically kind of dictates what you may or may not experience also, because you hear about metabolic syndrome, and insulin resistance. So all those things dealing with, once again, your weight, obesity, BMI greater than 30. And that just goes into play once again, where Dr. Romunda's talking about, again, what we eat, the girth of your gut, just your whole body weight distribution. So once again, that's the correlation. A lot of things come in, but it depends on the individual. And a lot of times, there's so much that comes into play as far as symptoms that we experience, and what we're needing to manage those symptoms. But yes, one of the first lines you want to do is lifestyle changes, which includes, dietary health, once again, good eating habits.
So I posted today about, and I said, decreasing the amount of estrogen and progression, my tongue done got twisted, during menopause can slow down the process of food processing through the GI system. When the digestive system process takes longer, more water is reabsorbed back into the bloodstream, which can lead to constipation, increased gas, and bloating. I posted that today. Menopause has a lot to do with that.
Anxiety is huge for people. I remember John will tell you he couldn't drive with me. He brought me to get out of the car if I got into the car, because I would white knuckle everywhere we were going, down a street, down a highway, down a hill was really bad for some reason. And we live in a mountainous community. And I was holding on for dear life, and my knuckles would turn white. I was so anxious to be in the car. And this went on for years and years and years. And finally, I'm like, oh, okay. And sometimes, it's like, oh, right, that idiot driver or whatever swung into us or whatever. But and Gabriela, you actually have something for anxiety that you do. Do you get anxiety?
I think we all do. I'm not an overthinker because I leave it to God, but I do use, I bought a 7 different magnesium supplement, since we don't have one of those multi magnesium products. and it really does help with anxiety. I think it's glycinate that helps with that. I'm not sure which exact, but there are 7 forms, I believe, of magnesium, and everyone has a different function, right down to maybe if you're constipated, there's another one for that. But I mean, yes, magnesium is very important for anxiety, and it's, I mean, I don't know. I'd like to hear our experts here on that.
But you'd be surprised how many people don't attach these to gut health. When I say think about gut health, they be like, oh, here she go with gut health again. Okay. They don't even understand the magnitude of what the gut does, by no means. And that's why it's so important that we educate them, have topics of anxiety. Anxiety comes from what? Respiratory, lack of oxygen to the brain, because now you're getting overwhelmed. You're starting to visual, you're starting to feel these things, So when you start looking at, okay, somebody said to you, is anxiety just as bad as, to me, it's important having an anxiety class, just as important having a CPR, because I've seen people go into anxiety and actually have a heart attack and die. You see, that's how deep anxiety can get. So if you're not sitting there with a person saying, hey, because I've had funerals, all 3 of my funerals, I did anxiety with people to make sure they're okay. So when people come up there and they get stuck right there and they get stuck. And what happens when they get stuck? They're not able to get the oxygen to circulate to what? To their brain. So now what happened? They get lightheaded and they do what? They pass out, And so my thing was to make sure that, hey, just take a deep breath, take a deep breath, just calm down, take a deep breath. And I have literally caught people in the midst of, and they stuck right there. And you got to say, hey, it's okay, calm down. And when they hear something saying, calm down, just breathe, that teaches them how to get control of their breathing. I think people are not being taught how to get control of their breathing.
Mindfulness,
yeah.
Yeah, where they're kind of able to redirect and focus, looking at 3 things, 3 objects, 3 colors, or just focusing on, sometimes just telling people focusing on 5 things. If you're driving along and all of a sudden you're having anxiety, what are 5 things around that you see, looking and seeing and naming them, whether it's a street light or whether you're looking at something and someone crossing the street and what they're wearing, but just quickly redirecting yourself when you feel that anxiety coming on. So you're allowing yourself to calm down and not go further into a full attack.
We're not taught how to handle anxiety. So when people get to, you just say count 5, 4, 3, 2, 1. Again, like Dr. Lori was saying, it's a mind over matter situation, not a matter over the mind. But what happens, the matter takes over the mind instead of the mind taking over the matter. And we loses that. So when you talk about menopausal and all these things that associate with hormonals, it's a lot of things that we're hormonally unbalanced. So we're chemical imbalance, we're hormonal imbalance. And so, but again, where does it all stem from? There has to have a host. There's a host for it. There's a bay for it. You see, and where does it sit? Right in the middle, because you got the brain. You always see the brain connection, the brain and gut connection. When you see talk about the brain, talk about the gut, they have a connection. You talk about mental health, same thing, gut connection. You see, nobody addresses those two there because again, it's a hormonal and a chemical imbalance. Just like we said about menopause, when you're losing those things and you're eating and not processing and go back to the bloodstream. And so it's so much to learn. And I'm so glad that Dr. Lori took time to come out and bring awareness to, because I think not only just tonight, but it's so much more that goes with this that people really have lost out and not really understand. As women, we should be we should have a whole rack of women on here tonight. We should have had an overflow of women on here tonight, because why? Every woman got a daughter that's gonna come up. You know what I'm saying? You got a granddaughter, you got friends that go through that. It should be over flooding tonight with these on this call. And this is what I mean by when the Bible speaks on how we perish because of what? Lack of knowledge and lack of vision. And when you got people on here that bring in this knowledge and you ain't got to pay for it, you can just sit back and listen and observe and take notes and ask questions and set up a consultation if need to. This is why it's important that we share these opportunities with people and say, hey, look, Gabriela gave testimony. Just gave a testimony. What helped her? Because when she realized what was happening, and we already know that certain things put back in your body. She could have been essential fatty acid, omega could be low. You see what I'm saying? But the magnesium, I tell people all the time, get some magnesium. She mentioned the castor oil pack. Where do you think she put the castor oil pack? On her gut. You know what I'm saying? Where do you think she put it? She put it on her gut. She stimulated her gut and she put it on there to what? Get that balance back. So it's just the littlest thing that people don't even realize that can make a world of a difference, only if they were just open to listen and mindfulness of what we talk about here. And I think, again, I'm so grateful that we have the opportunity to bring awareness, education like this, as Dr. Ronnie do Red Hot Topics. You know, all these things are so important that we educate people and have that time to listen. You always hear me say, we got to listen. We got to listen to each individual person that is going through something so we can help them to put them on the right track.
When we were on our detox, I really appreciated the fact that we were taking our probiotic. Our probiotic is amazing. It's called prebiotic, and it does have 5 forms of different bacteria, transfer factors, and it's got these little coconut pellets that are time release. Most probiotics just go in and out. Those little pellets, don't chew them. They're very essential to basically make it down to our lower intestine. And like Dr. Romunda mentioned, they are diversity in probiotic is important because it's a gut-brain connection and also heart. And there's a lot of studies that have probiotics for mental health, you know? I mean, I think it all stems, like Dr. Romunda and Dr. Lori say, from the gut. It's common knowledge, you know, what we eat, what we drink, how we drink is health, you know, and we just have to have the discipline to do it. And also the knowledge. And coming from these 2 wonderful experts, I mean, if we could only have some kind of a kit that they could offer our group where they can, if they have the ability to test our hormones, test our, whatever it is that we want to get better, because we want to get better. We want to have vitality, and we don't want to have hot flashes. I mean, personally, me, I felt like my head was going to explode. It was horrible. But anyway, that's
and I do the microbiome gut testing. Remember, I do the microbiome gut testing, and it talks about the microbiome. It talk about the species. It talk about the pathogens. It talk about all these things, and it talk about those numbers of where we at in our gut flora, so we can see. So when I got mine back, I was like, oh, I know I increased my prebiotics. I already knew what I needed to do. They give you a chart list. I said, oh, okay, so that's what y'all recommend. Oh, I got that right here. I can just increase this. I can increase my olive oil. I can increase, I have it right here with me. And I can also cleanse as I'm increasing. So you're getting rid of old stuff so the new stuff can work, you know, and that's how you eliminate the hot flashes or get your hormones back together, because you're getting rid of toxins. The toxicity levels that build up in our body is what causes us to be unbalanced. Right, Dr. Lori?
You are correct. I mean, when toxins are in the systems, it just generally throws our body off, period. And probiotics are helpful in maintaining balance in the gut and maintaining balance in the vagina. So once again, yes, that part of it is very true. With probiotics, it helps to maintain that balance, and just getting rid of toxins, cleansing your system can help deal with a lot of issues, and menopause definitely being one of them.
I have done a dish with a probiotic. I have done it also through the gut. Yeah, I have done it through the gut and because it's about the pH level in your vagina area. You have to get your pH levels back balanced out. People don't realize how acidic your vagina area is. So you have to put the pH level of your probiotics back in it to build the flora back in. But I've done that. People probably like, y'all probably be like, whoa, that's a little heavy. But I mean, in order for you to understand your hormones and what we're deficient in, you got to get to the areas of our girls and put it back in check. Because again, when you have a menstrual, what is coming out of there but toxins? So what do you got to do? You got to replenish your pH level with what?
So I thank you both for co-hosting with me tonight. It's always a pleasure to have you, Dr. Romunda and Gabriela Daughtrey, on the show. You can find Dr. Romunda, romunda.ings on Facebook. That's how you find her. And Gabriela Daughtrey is easily found on Facebook. And you can always ask us through Feel Good, Share Good on Facebook how to reach out to them. And Lori, Dr. Lori, share a last word of wisdom with our audience before we say goodnight.
Walk away with any wisdom tonight. I would say that if you're experiencing anything that I mentioned, to make sure that you say something, because no one should suffer in silence. No one should suffer in silence. So that's what I want women to take away tonight is please do not suffer in silence. We're having the conversation. No, you are not going crazy. So if you're experiencing anything we discussed tonight, and as everyone's mentioning, take care of yourself. I think you should definitely consider those dietary changes that we discussed and the use of the products that was discussed, because they sound awesome. And I mean, again, anything that can help with the symptoms is a win, So again, thank you all. And I wish you the best.